So if you look at US data, Black men are about 1.6 times more likely to die from heart disease and at young ages compared to white men. Okay. They experience earlier onset of high blood pressure, which you brought up. They have higher rates of heart failure and stroke. They have greater mortality when they do have a heart condition, and they have more severe complications of these risk factors, dialysis, and other conditions. And we have to keep in mind that race itself is not the disease. As we said, the drivers are a mixture of biology, the environment, access to care, chronic stress, and nutrition, our sleep habits, and most important, economic inequality, right? The system, and a mistrust in the system, especially for Black men. So these disparities are really driven by these factors and not necessarily by genetics, even those genetics do play a role. And when you look at Black women, they tend to experience a higher burden of specific risks like stroke and hypertension compared to men, or compared to, I shouldn't say men, compared to other ethnic groups. However, Black men are more likely to have a higher mortality rate. And for women, it's at a much older rate. So when you look in Barbados, the Barbados National Registry for Chronic Diseases actually tracks and records data on cancer, stroke, and acute heart attacks here in Barbados in order to help improve, health programs and to monitor disease. And in 2022, that's the most recent data we have of everything, 556 Barbadians had a heart attack, 765 had a stroke. That's about 10 heart attacks a week, about 14 strokes a week on average. So this may not seem like a lot, but given our small population,
it is a lot.
It is a lot. And if you look at, so easy way to look at it is that for every 100,000 men in the population, about 146 had a heart attack and 98 died of a heart attack. When you look at women, 89 out of 100,000 had a heart attack and 64 died of a heart attack. So, and this is just in 2022. So as you can see, men make up slightly more than half of those cases totally. And most of the men, in the men, the cases occurred mainly in the 55 to 74 age group, whereas in women, it was above the age of 85. So younger men are developing these conditions. So these figures from 2022 are one of the highest figures they had seen in the 14 years they've been following these numbers. I don't want to assume, but I'm the sense I get is that those numbers are going up, despite what we're trying to do. If you look in Nigeria and the rest of Africa, cardiovascular disease is now accounting for 1 in 3 NCDs, almost getting to the point of infectious diseases, which are the number one causes of death in Africa. And of course, these rising cases are being driven by lots of things, rapid urbanization, sedentary lifestyles, everyone has a car now. So all of this is triggering an increase in high blood pressure, diabetes, obesity, and causing more cardiovascular disease. And hypertension is one of the biggest drivers in Africa. And it's not so much that these are just statistics, right? If you don't die from your cardiovascular disease, you're left with a disability. So which impacts your ability to work, it affects your independence, it affects your family, your workplace, income, everything. And then that even adds more stress to everything. So one of the things is we have to ask is, why are these numbers going up, right? And some of that just has to do with some of the stubborn rise in these risk factors, the risk factors we discussed, and delays in not getting treated, not recognizing these risk factors, not having warning signs, presenting too late. And when you do get to the hospital, sometimes you don't get the care that you need, either because of lack of resources, which is an issue here in Barbados, and also even in the U.S., depending on places you live. You don't get access to, as we talked, it depends on where you live as well. There's also inequalities in terms of treatment, and they've seen that as well. So all of these things are why heart disease is such a big deal